I'm ready. You ready?
I'm ready.
Are you sure?
Yeah.
No camera can see you right now, I promise.
Okay.
You good?
Yes.
Okay. You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET podcast.
You can edit it if you need to.
Oh, we don't edit anything.
Okay.
And there's secret cameras on you right now. Just kidding. Hey, everybody. Welcome to the NeuroRESET podcast. Today, we have a very special guest, a longtime listener, first-time caller. Christina's with us today. Today's topic is ultimately going to talk about how to avoid back surgery and kind of the road that it entails going through that journey. So I'm going to tell kind of the intro, but I'm going to have you follow up. How's that?
Sounds good. Glad to be here.
Awesome. Great to have you. Thank you for doing this. So what I did was I scared her and told her that it was a podcast, but not a video podcast. And so now that's why I'm the only one on camera. So you guys will never know who she is. And that's how she likes it.
Thank you.
I was lucky enough. I had the honor of answering a phone call when I first opened this office. I think you were the first person to respond to maybe a Facebook ad. And you called the office and, hey, this is Desert Brain and Spine. My name is Russ. How can I help? And I was pretending not to be the doctor. Do you remember that?
I remember it differently.
You?
I remember you actually did say you were the doctor.
I said it after I was listening to your story, and because I think I had one chance to try to help you, and I wasn't gonna lose that chance by having you think that I was like an assistant or something, right? Like, hey, let me just schedule this appointment. I didn't have that opportunity. So I said, you know what? I'm just joking. This is actually Dr. Teams. Let's have this consult right now. And then we did. And you said, I've tried everything. And I think I said, you haven't if you haven't been here. Something
Correct.
along those lines.
Yes.
At least that's how I remember it in what I call my superhero story. But okay, so how do you remember it? How did it go with you?
There's not much I remember during that time besides the pain, to be honest with you.
Yeah.
I was in so much pain. I remember I broke down crying over the phone because I really had lost hope. I thought when I saw your ad on Facebook, I thought it was something different. I wasn't expecting a chiropractor. And the reason why I broke down when I heard it was a chiropractor's office was because I had tried going the chiropractor route before as well, and it didn't help me. So
Nothing
I
did
felt
at that point, right?
nothing. I tried acupuncture, I tried laser along with the chiropractic treatments that I tried. The adjustments were just making it worse. Nothing. I tried 2 other online like video programs that were claiming to help me get out of pain. I tried just waiting it out. Absolutely nothing helped.
Yeah. And I know I think your mom had a surgery, right? And you had said, you're like, I don't want to deal with that at all. I don't want to go through what she went through, right? And I mean, so so you tried all those things. Where were you? Where was your mind when you made that call?
Um, I was really just I had given up faith in getting better without surgery. I had booked surgery, and it was only like I'm thinking maybe a month out at that point. Um,
Like the actual surgery was scheduled.
the actual surgery was scheduled. Yeah, and like you said, my mom had a similar issue in the past. She had a herniated disc, and when I was younger, and she had back surgery that didn't help. In fact, the first surgery she had made it worse to the point where she had to have another surgery. And I seen her suffer. I thought, this is my faith. This is what
Because you'd
is
seen it
bound to happen.
before you thought it was going to happen to you.
Correct.
Yeah. Now, without spilling too many beans, did it happen to you?
No. No.
I love it. So, so let's walk. I mean, your case is to me is so special, not only because it was really one of the first ones in this office, but because it was so profound. Um, just watching you move through from basically, I don't know, being on the verge of tears every time you'd come in, just like kind of holding your leg, and like just, I don't know, I'd almost use the word skittish to like do anything and just afraid because I know for those listening, she'd gone through the PT route as well. A lot of times it helps a lot of people. This particular one I think had you do just a weird little lateral translation move to try to like straighten up your spine because your posture was all really contorted because it was the only comfortable position you could be in. And so this PT had you try to shift that basically to oppose it. And that's the day it went down your leg, right?
I I wouldn't say that that was the day that it went down my leg. You're right. I did do physical therapy. I forgot about that. That wasn't helping at all because the pain had started in my hip. Um, and so I really had no idea. I thought maybe I just moved funny. So I went to a physical therapist to try to help. And that's when they started me, uh, they had me start doing those weird movements. But the pain was just getting worse and worse every day. There wasn't a specific time that I could remember all of a sudden. It was in my leg. Um, but I do remember I was stretching and doing everything they had recommended, and the pain was getting worse. And then one day when I was doing my stretches, all of a sudden I could barely get up.
Oh man, just so much pain you could move.
The pain was just severe. It felt almost like my nerve in my leg was not long enough to stretch all the way down. So any type of movement
Uh,
was excruciating, and it even hurt to turn my head.
Really?
Hmm.
Wow. So at that point, when you were going through that, had you had an MRI yet?
I had not had an MRI yet.
How important do you feel like getting an MRI was?
Not that important, to be honest with you. The MRI in itself, I think it just solidified what I had already known. I
Like what
feel
you
like,
basically figured out, you're like,
yeah,
hey, it's not this, it's not responding to these things, it's got to be this.
it
Yeah.
has to be that. I mean, it was nice to see it just to get an idea of like, okay, this is what I thought was going on. Initially, I thought, okay, I probably do have a herniated disc. I just have to wait it out and be careful, and it's gonna get better. Um, but after trying all of those and it wasn't getting better, that's that's when I decided to turn to, okay, I think I am going to try surgery. And then what they don't tell you about surgery is that it wasn't until my pre-op that I found out that they consider like 80% of these surgeries are successful, but what they consider successful is not completely pain free. They consider successful being that you don't have any more pain down your leg. You could be left with debilitating back pain, but they still consider that a successful surgery.
That's
And that,
crazy.
yeah,
And they told you this in your pre-op.
in my pre op, yes,
So you're like kind of gung ho about like, hey, this is my last option. Whatever happens, happens, but it won't be in my leg, right? And that's your thought, I'm sure.
correct.
And probably pain free because you had both back pain and leg pain.
Yes,
And then they tell you, hey, we could probably take care of the leg pain, but the back pain is a total coin flip.
yeah,
That sucks.
yeah. I broke down crying in the pre op room. Um, and that's when my husband was just like looking at me like, oh man, this is probably going to be a forever thing, because he was thinking, let's just get you into surgery, you're going to be fine. He's never experienced what I experienced with watching my mom. He never had anybody
Yeah.
go through that. And in the back of my head, I was going down a dark road because I was scared. I didn't want to end up on pills, having to take pills. Even the pills that was taking that they gave me, it wasn't even touching the pain.
Yeah. Wow. So, you know, when I talk to anybody about their case, I kind of draw like like an air puzzle, right? And with any case, and this has been proven across all research articles, all studies, is that there's psychology associated with every case, right? And what you're describing is you're like, I already know what's going to happen to me because of this history. That's basically psychology. So you start acting and thinking like that, right? Like you were already acting like a post-surgical patient before you got surgery.
Wow, I didn't think about it that way.
It's pretty crazy, right? And
Yeah.
so one of the things that we had to do was is basically have these discussions surrounding what life's going to be like when it's better,
Mhm.
right? Like how much did we talk about Disneyland?
A lot.
I talked about Disneyland all the time. And what did you get to do last year or earlier this year?
I got to go to Disneyland.
Right? Like you might not have been 100%, but
Oh,
I mean, you were pretty darn close
I was 98%.
without surgery.
Correct.
What did we do to help you?
Well, I really think that the biggest component that helped was the I would say specifically the PEMF
Yeah.
helped a lot because it helped bring down that inflammation
Hmm.
so the traction machine could actually do its job
Right.
and work. Um, but overall, like as soon as I started having that little bit of relief,
Hmm.
I my mind, I think just it that hope came back.
Yeah.
Yeah.
That's awesome. I actually remember, I think it was over Thanksgiving break. I call it a break because we didn't work that Friday. So we had, I think I saw you on a Wednesday because I saw you every single day for I think it was 2.5 weeks. And that was right coming up to your pre-op.
Mm-hmm. Yes.
And at that point, I think you'd still had the appointment for the surgery. And then you came back from that Thanksgiving break and you said, that's the best I've slept in like over a year. And I was like, we got it. And while it wasn't necessarily a completely smooth ride after that, like, the body is designed to heal. It's not designed to feel good all the time. And it's not a linear progression on how good we get, right? Because the body has to now adapt to new things. And as we continually push the body with the decompression and pulling more, different positions, right? We tried a lot of different things in that first couple of weeks. And then we finally freaking nailed it. And to hear you say, and I remember Kathy's response. I remember Rihanna's response to you saying that's the best you've ever slept. They were smiling ear to ear for you. And it was, I mean, it couldn't have been outdone by your smile either. It was as if the pain had completely gone away, but we just got like a glimpse of what could be. And that was upstairs. That was in the old office, right? And now we've got two tables, and you saw as many people on there today as you've probably ever seen. And so we did PEMF, which was reducing the inflammation, right? So for those listeners, PEMF is a pulsed electromagnetic field that, in a way, kind of recreates the world's or the Earth's magnetism and discharge rate. And so what we're doing is really exchanging electrons with the Earth when we contact it, so kind of like grounding. But these mats recreate that same environment. And so what it does is it helps improve circulation, which is our immune system is in, and that's what helps fight this inflammation, right? So it decreases pain, decreases inflammation, helps to basically recharge and stabilize the electrical charge within your body, which is, if you think in terms of vibrations, what kind of level are you going to be vibrating at if your sympathetic system is off the charts because of pain? Probably not a very good one. And so as we reduce inflammation, we help basically move your body into a healing state, right? So PEMF was like a game changer for you because it was, I think, the only thing that you hadn't tried before, right?
Correct. Yeah, and I'm forgetting other things that I've tried. I've even tried um a prolozone shot,
Mm-hmm.
which is pretty new. That was suggested by my naturopath, and that helped slightly. The first shot helped, but it didn't heal. It
Right,
didn't take away that severe
right.
pain. Yeah.
And a lot of patients, from what I've seen, the first thing that they think about is let's get rid of the pain because most people don't understand how bad these problems can be. And so most people think that, oh, I just tweaked my back or it's a muscle spasm. So they go and do the things to just knock out the pain and it'll generally heal itself. And it works for a lot of people if the problem is within that scope of what that will take care of, right? Um, the thing with like cortisone shots is I don't love them because what they do is basically break down the tissue the more you get. It's a really weird phenomenon. It knocks out the pain and inflammation, but it causes a problem that's not there.
I agree. I didn't do a cortisone
Yeah,
shot.
because you
That's
do
why
your
I stayed.
research.
I did a lot of
Yeah,
research and I decided to stay away.
yeah,
And also because my mom has had several and they didn't help her.
yeah,
In fact, I read horror stories of people getting worse
yeah.
after the shots. So I
Mhm.
decided to stay away from that completely. I just didn't think it would help. Plus, I was 2 weeks away from surgery. In fact, the surgeon said, "Don't worry about the prolozone shot. It's not going to help." He told me, he's like, just the only thing he said, the only thing that will help me at that point was surgery because I had been like that for just about 6 months. And he said, if my body didn't heal it on its own within 3 months, then nothing will make it heal.
Now, have we found that to be inaccurate?
Yes.
Yeah, we have. So, you know, to fill everybody in on what we did with her is first and foremost, I actually didn't do any adjusting.
None.
And so because you know, when you look at the history, you say what worked and what didn't work. Okay, nothing worked. All right, let's figure out what's going to work. I'm not going to repeat the things that either didn't work or made you worse. Just because I'm a chiropractor doesn't mean I have to adjust you, right? I'm going to my call it my oath is I'm going to do what's needed for you to get better. If I have to ring a bell over in the corner and light some sage on fire, I will do that, right? That's actually more my wife's forte. It's not me. But you know, we started with decompression. We went really light at first just to make sure we didn't flare you up. In the beginning, you're like, I don't even feel anything. I'm like, great, perfect. I don't want to scare you away. And then we started just very gradually and moving it higher and more pull. But we were seeing you daily for like 3 weeks.
Yeah. And at first, in that first week, I mean, I was coming in, but I was not hopeful
Yeah,
at all. I was just like, let's just see.
yeah,
But I was desperate,
yeah,
but I was not hopeful.
yeah. And it was about 2.5, I want to say it was about 2.5 weeks. And then we had that eureka moment. And I think we never turned back since. And so we did decompression. We use laser therapy also to help reduce inflammation, but we use it through the abdomen, right, on the front,
Hmm.
because that's our vagal system. And our vagal system is our resting and digesting, calm, cool, collected system. That's our healing side of the nervous system. So when people are in real chronic pain and that nervous system is in the fight or flight stage, you're not going to heal. Like it's exactly the opposite, right? So we did everything we could to put your body in a healing state so that your body could handle the rest, right? So we do laser, we do PEMF. I think we did some vagal nerve stim as well, right?
Yes. Yeah.
Yeah.
Hmm.
And then we didn't do any chiropractic. We didn't have you doing any exercise in the beginning. And then as we start to have these responses, we start to maybe hit like a plateau here and there. So we shift the table around. And so where we started you actually face up on this table doing gentle pulls, we're now face down doing like a pretty decent pull to make sure that this never comes back.
Hmm.
Right. And so that was really pretty straightforward for what we did. We had to get very specific. If you remember, we had to tweak the table to a very specific degree and a very specific position. And like we had to put the strap, the hip strap on in a very specific way to make sure that you got exactly what your body was asking for. And so we repeated that we repeated that every day for I think 3 weeks. And then we backed you off to 3 days a week. And then we backed that off to twice a week from 3 days to 2 days to one day. Now we're like on a once a month maintenance thing right now.
I think I'm still doing 2 days a week. I'm
Two
sorry,
twice a
two
month,
days a week.
twice a month,
Oh, it's actually once every 2 weeks.
once every 2 weeks.
Yeah.
So, um, and so you know, it was the coolest thing to say, look, doc, I can touch my toes again without having pain.
Honestly, it didn't even matter to me if I could ever touch my toes again. I was just so happy to be out of that pain. I mean, the pain was so severe. And that's why we were so happy just for me to get a good night's sleep for once
Mhm.
because I hadn't gotten a good night's sleep in months. I was up crying on the floor in pain. My husband was laying there on the floor with me because I didn't know what else to do. Like laying down was painful, sitting up was painful. On my side, there was just no position that didn't hurt.
Yeah. Now, did that affect you as like a mom?
Absolutely. I
How,
couldn't.
in what ways?
Well, my son at the time was really into pretend play and just the kind, like being chased around the house, and I couldn't do that. I couldn't even get on the floor with him to really uh, put some Legos together. My state of mind and being that lack of sleep, I wasn't eating well, everything just kind of I could barely dress myself in the morning. I was not myself to the point where the times where I wanted to play with my son, he was pretty much like helping take care of me.
How old was he?
9.
Oh my gosh. What a, did that, I mean, what kind of impact did it have like on like the marital relationship?
Goodness. It was tough on our marriage as well. My husband had to take on more of the household chores that I did, um, along with his full-time job and helping take care of just everything. I wasn't myself,
Yeah,
and time alone that just wasn't happening. When you're in that much pain, that is the last thing on your mind.
right.
Um, so
Have you guys gotten any date nights since?
yes.
Awesome. Great. Well, I had the pleasure of meeting him too. He enjoys the outdoors like I do, so we have great conversations. And he was very thankful when he came in. But it's really been more of a pleasure for me to get to meet you. You and him, and I'm still looking forward to meeting your son if you ever introduce us.
I will. I'll bring him in.
And just to watch your outcome has like I'm never going to forget that. So anybody that walks in that says I'm ready for surgery, I'm like, guess what? This story right here is true. I watched it happen. I was part of that process, and it can be the same for you too. And so that's the only I think. I think a lot of doctors are. I think they want to help, right? I know there's some out there that probably shouldn't be in the profession, but they're good enough. I also know that there's a lot of realists out there that are, you know what, you've got this herniation, you probably just need surgery. They just don't have the tools to do, to help someone with that. Luckily, I bought the right stuff, and we put it together in a way that we were able to help you. And I'm just so thankful to be sitting here and just looking at the smile on your face and to be able to share this story because you know how many other people are dealing with this. And I hope that your story helps other people. Just take the chance and go outside the box a little bit and really find the right person to help them. Right. So, anyway, I do want to thank you for coming on this podcast and sorry for scaring you with a video podcast, but you would have done great. Spinal decompression, anti-inflammatory work, thinking about life without pain are all keys to getting you better, right? Also, what about breathing? We breathed a lot too, didn't we?
We
There
did.
was a lot of anxiousness in the beginning. I don't see that anymore.
Oh, that's great.
Yeah.
Yeah.
You're like, I just don't see it.
I do. I work on my breathing when I remember to as well
Yeah,
now, and
it's a
it
cool
does
tool,
help.
right?
It helps. It's huge, and I thank you so much. You've changed my life. Thank you for getting me out of pain and preventing what could have been a horror story with surgery. Um, it really could have, like I said, they say only 80% of those are successful, and success is no leg pain. It doesn't mean no pain at all.
Wow.
So who knows what the true number of true success of like I'm people that are no longer in pain
Yeah.
are. Um, so that's if I can help, if my story can help anybody, I mean, I urge them to, even if it's just 2 weeks like me. Like I said, I had surgery booked, and I told myself I'm going to give it 2 weeks. That's it. And if it doesn't help me, then I'm going to go forward with this, even though I don't really want to. I'm going to go forward with it.
Yeah.
It's worth it 100%. It's given me my life back. I can run around. We have a golden retriever now. It's
Oh, I love
awesome.
it. Little terror, little ball of terror,
Little
right?
terror, yes. And he was taking me for a walk, for for a
Yeah.
good year there for
Yeah.
a while, and until he got fully trained. And I could have gotten hurt again, but thank God, I
Yeah.
didn't. I've been coming in, following up, and taking good care of my
Yeah.
back.
Yeah. After we got you out of pain, we moved on to strengthening and stabilizing, right? So we started doing stuff here, kind of the basics, right? We do things like bird dogs and planks, and we do we might do a little power plate activities. And then it's like, hey, you know what? You've outgrown me. Go see Donnell, right? Go see your trainer. And I think he took it from there. But he pushed you a lot, right? There are some things where you're like, ooh, I don't know about this, but I
Yeah,
think that's all working out just fine.
it's going great.
Yeah.
Yeah.
So the last piece of this is, and this is why I wanted to have video at least for part of this. So if you're watching, what I'm about to show is her pre and post MRI. And, when basically you can look at something about the size of, I don't know, maybe a pea or like a bean or something. I don't know how big would you say that thing was? I don't remember what the report said, but it was probably about a centimeter,
Yeah,
is
the
my
report
guess.
didn't say. I don't remember it saying, but you can tell. I
Yeah.
mean, you
Oh
can
yeah.
definitely see the
Oh yeah.
difference.
I mean, it was big enough to completely crowd out your entire spinal foramen, which is where the nerve exits on the side. It kind of creates a little hole between the upper and lower vertebrae. And the disc is about 50 to 60% of that. So a lot of people come in and they have the bone taken out, but the disc is still there. So it's still irritating the nerve, which is kind of what you're talking about.
Yeah.
Other people have microdiscectomies where they come in and clip the disc off, but the compression problem's still there, which is why decompression is the best treatment application for this.
Yeah, and one thing I did want to say about that is that's the surgery that I
Uh-huh.
was booked for.
Oh,
It was a
okay. Uh-huh.
microdiscectomy, and they were telling me that, of course, they're just going to go in from the side and just clip off the little part that's touching the nerve, and it's going to be like, it never happened.
Yeah.
However, it wouldn't be like it never happened, because once they go in and mess with that, they did say it could actually compress the disc a little bit more. And the disc itself never recovers from that. So with that, that explains why some people are left with back pain
Uh-huh.
after surgery, because then you have a whole nother problem on your hand, which is that compression.
Correct.
And you could possibly have that bone on bone and then need a different kind of surgery later
Usually
on.
it's a disc replacement or a fusion.
Fusion is what they said.
Uh-huh.
Yeah.
So what you're telling me is they told you, hey, you've got a herniated disc. The only way to treat it at this point is to clip it off, but in doing so, we're going to actually make it more unstable.
Yeah.
And there's a good chance that you're probably going to have something done in the future to stabilize that. So what we're going to do is then fuse it so it can't continue to do that, which is a little more invasive of a surgery. Not only does it potentially increase the risk of whatever outcome it is, it also changes the entire biomechanics of your lumbar spine, which then puts more pressure on the discs around it, which I can tell you from experience. I see people who have fusions, the ones above and below always become problems.
Yeah.
I can look at a fused spine and still see compressed discs, still see herniated discs, bulging discs. I have another guy that I just started on this week. He's in your process every day. He's already had a surgery in his low back about 6 years ago. The exact same level on the exact same side is now protruding instead of herniating. So it's even
Oh,
worse.
wow.
So we've got a little bit of an uphill battle. He feels basically exactly like you. He's like, am I left with this forever? I was like, dude, listen to this story. And so I'm going to have him listen to this so he can hear it from the horse's mouth.
Yes, I hope he does. Yeah.
So,
I can't wait to see him better.
me too. Me too. Well, I really appreciate your time. Thank you. You didn't have to do this, but I really do appreciate you sharing your story, and I know it's going to help a lot of people. So, thank you very much, and I hope you have a wonderful holiday. I know you will. enjoy Flagstaff. And thank you, everybody, for listening to another episode of the NeuroRESET podcast. This one was a special spinal decompression episode. We'll see you next time.